Welcome to Psychologic with Umpile S, the channel on which we talk all matters mental health and relationships. Thank you for tuning in and for watching previous videos. Thank you for sharing them as well as for subscribing. I hope you do more sharing of that and hope that you have gained something that you are applying in your own life or helping another loved one through their own journey. So today we are continuing on the journey of mental health and building on from our last video in which we talked about stress and how our body and our minds react to stress. We did say that in the event that we are not able to cope adequately with stress, there is a big likelihood that we may develop some sort of mental health disorder. And I want to touch on what are the different types of mental health disorders that people are experiencing out there. And starting with the most common ones, I want to start with the spectrum of anxiety disorders, which is quite common amongst the population today. So let us start, and I'm just going to share my slides here with you as we talk more about this mental health illness under the topic anxiety disorders. So, what is anxiety and what are anxiety disorders? Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about things that are to come. And we'll differentiate now in the next slide the difference between fear and anxiety. But anxiety disorder is a mental health disorder characterized by feelings of excessive and persistent worry, anxiety, and fear that are strong enough to interfere with your ability to function on a daily basis. Anxiety disorders include disorders that share features of excessive fear and anxiety and the related behavioral disturbances. So these are disorders that you may experience at an emotional level, but also you will see the manifestation at behavioral level. Individuals with anxiety disorders typically overestimate the danger in situations they fear or avoid. In other words, you find that their fight or flight response, as we explained in the previous video, relating to how we react to stress, that response is malfunctioning somehow, in that there's an over-exaggeration of things that may be normal in daily life. But for the person who is suffering from an anxiety disorder, this exaggerated, anticipated fears are real. Let's move on then to the difference between anxiety and fear. We did say that the two can actually overlap. Fear, however, is more related to something that is real and imminent. For example, if I'm about to go and write an exam, it's normal for me to feel a bit apprehensive, to experience certain anxiety symptoms, because this is something that is about to happen. You're about to make a presentation. You're about maybe to do something out of the ordinary that you normally don't do. You will likely experience that level of fear, and which we normally call anxiety. And anxiety that may cause a disorder, on the other hand, it's about an anticipated future threat that may or may not happen. And in most cases, the likelihood of that threat coming to pass or happening is quite small. So it's really about worrying about things we shouldn't pay so much attention to. Secondly, fear is more often associated with surges of autonomic arousal necessary for fight or flight reaction, thoughts of immediate danger, and escape behaviors. And on the other hand, anxiety is more associated with muscle tensions, vigilance in preparation for future danger, and cautious or avoidant behavior. So in other words, we may start to behave in ways that we try to avoid the thing happening because we think it's going to happen. Whereas fear is about this thing is real, it's happening, let me avoid it because I can see it's about to happen. So that's the difference. I hope you get it. All right, I'm just going to go back and stop sharing as we continue in the process of just going on about anxiety disorders. How prevalent are these? Anxiety disorders are very prevalent. I've found in my practice that I do work a lot with people that present with generalized anxiety disorder, or even social phobia or social anxiety disorder. There are other forms of anxiety disorders that are also very common, such as your post-traumatic stress disorder. Because we live in a very violent society in South Africa, that is also one of the more common ones. But anxiety disorders are very prevalent in the population, with up to 30% of the population being estimated to experience an anxiety disorder at some point in their lifetime. Also, in terms of prevalence, anxiety disorders seem to be more prevalent among women than they are amongst men. More so from a socialization point of view, where it's more permissible for women to express their emotions than it is for men. Also, anxiety disorders, it's important to also recognize that they develop more prevalently even from childhood and will persist up to adulthood. It is also common, however, that such disorders can also manifest for the first time even in adulthood. All right, let's move on then to some of the symptoms of anxiety. Once again, I'm just going to share the screen here and for us to go through these symptoms. These are symptoms of anxiety disorders in general. They will be probably more prevalent, or some features can be more prevalent in some anxiety disorders than they are amongst others. And as we go through the various anxiety disorders, I'll be highlighting some of the symptom specifics that are related to those respective disorders. But generally speaking, these are some of the symptoms that we're likely to experience when you are experiencing some form of an anxiety disorder. At the physiological level, there's often muscle tension, heart palpitations, shortness of breath, sweating, or even chills, dizziness, trembling, nausea, or chest pains. You may have experienced some of these, which are more common with your panic disorders, especially when you are about to do something significant. But depending on what type of disorder it is, the symptoms might persist long, or they might actually disappear after the event that the person is facing at the time. At a psychological and emotional level, there's often experiences of poor concentration or inattention, memory problems, racing thoughts, fear of dying or fear of losing control, sometimes even just fear of developing a mental illness, or dissociating also from the experience or the event that one may be experiencing at the time. Behavioral symptoms include lack of sleep, or poor sleeping, or poor quality of sleep, depending on different experiences that people may have. Avoidance of situations or events that may cause anxiety, low energy, restlessness and irritability, poor performance, such as not doing very well at school or at work. So these are just some of the general symptoms that are often associated with the anxiety disorders, depending, and they can be prevalent depending on which disorder we are talking about. And what causes anxiety anyway? So there are a number of causes. There's never like a linear relationship between the causes of mental health disorders. There's always a combination of either environmental, sociological, and psychological, or even genetic factors. So when we're talking about the causes of anxiety disorders, here are some of those causes. The first one being hereditary or family history. It's been found that anxiety disorders are more prevalent amongst families or children of parents that have experienced some form of mental illness themselves, or particularly have suffered from anxiety disorders themselves. And also studies of twins have also revealed that, for example, if one twin is suffering from an anxiety disorder, the likelihood of the other also experiencing the same is high. As such, conclusions have been drawn that there must be some hereditary link in terms of causation of anxiety disorders. There's also stress-inducing life events, especially when they happen or in childhood. They can happen at any stage, but particularly in childhood, trauma experiences that may include physical or sexual abuse of children, neglect, any hard life experiences that have an impact on the emotional development of a child. It's likely to affect or influence the development of anxiety disorders later on in life. Health-related conditions such as medical diagnoses like cancer, heart conditions, or even asthma, they are also often related with anxiety disorders. Brain chemistry and hormone imbalances have also been linked to anxiety disorders. Certain personality traits such as neuroticism, low self-esteem, and just generally not having adequate coping skills have been found to also impact on the development of anxiety disorders. And lastly, the use of substances or abuse of substances, which may include smoking, alcohol, as well as the use of drugs, have an influence on the development of anxiety disorders. Now, what are the type of anxiety disorders that are there? I'm once again going to be sharing the screen so that we go through this. We will only touch on 2 of these in this video today and cover the rest in the next video so that we don't have a very long video. These are the type of anxiety disorders that people will normally experience: the generalized anxiety disorder and panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, social anxiety disorders. And then also we have the phobias, which will be specific to specific places or animals even, because we do have people who fear snakes, for example. So there will be specific phobias as part of the anxiety disorders as well, separation anxiety disorder, as well as selective mutism. The last 2 are more likely to be experienced in childhood, and we will tackle them separately as we go along, although they actually can happen also even in adult stages, but they are more prevalent among children. Today, we will be touching mostly on generalized anxiety disorder and panic disorder. So let's look at generalized anxiety disorder. This disorder is characterized by persistent and excessive anxiety and worry about various domains, including work, school performance, that the individual may find difficult to control. Some of the things might or stressors may range from finances, for example, relationships, even just general stress of relating to anything that people deal with on a daily basis. In addition, the individual experiences physical symptoms, including restlessness, feeling keyed up or on edge, being easily fatigued, difficulty concentrating, and their mind going blank, irritability, muscle tension, and sleep disturbances. These are some of the symptoms that a person suffering from generalized anxiety disorder is likely to suffer from. And having gone through this, I just want to go through the diagnostic criteria, because not all of those symptoms that we have looked at have to be present for a diagnosis to be made when it comes to generalized anxiety disorder. So what is the criteria for that diagnosis? A person needs to have excessive anxiety and worry occurring more days than not, and for at least 6 months, about a number of events or activities such as work or school performance. They need to be worried about these general things that we deal with on a daily basis. It might be, as I said, also including finances, including relationships, but being worried and excessively so about one or two of those areas. The individual must find it difficult to control the worry. And I think also looking at that first criteria, what's important there is to note the period of 6 months. Yes, you might be experiencing some of those symptoms that we will go through, but often we need to also look at, is there an event, for example, that would have happened before that triggered the experience of those symptoms? And if it's less than 6 months and there was an event, it could be that the person might be suffering from an adjustment disorder, which has not as yet developed into a generalized anxiety disorder. Note that with generalized anxiety disorder, there doesn't have to be any specific event. There doesn't have to be any trigger that would have led to the person feeling in a certain way. And looking at then criteria number C, the anxiety and worry is associated with 3 or more of the following 6 symptoms. So even though we've read all those symptoms, even in the previous slide, not all of them have to be present for one to be diagnosed with generalized anxiety disorder. Only 3 of those need to be in place, and they must be in place for more than 6 months. First of all is the restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating, or your mind going blank, irritability, muscle tension, sleep disturbance or difficulties falling or staying asleep, or restless, unsatisfying sleep. Criteria number D, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So you would have noticed that because of the way you are feeling generally, your performance at work is deteriorating, or your relationships are also being affected, your home life and the quality of life that you used to have, or even your social life is being affected. That is significant to note as part of this diagnosis. Also very important that the disturbance is not attributable to any physiological effects of a substance. For example, it's not as a result of any drug use or medication or another medical condition, for example, hyperthyroidism. So those are some of the exclusions that need to happen to make sure that you are, if you are going to be diagnosed with that this disease, for example. Lastly, the disturbance is not better explained by another mental disorder. Anxiety symptoms are very common with other mental health disorders such as depression or even schizophrenia and bipolar disorders. So it's important that when a person or reports that they experience these symptoms, that it's not part of another disorder in mental health illness. And it's important then that this diagnosis, because this, as much as these are the diagnostic criteria, there are other cultural factors that play an important role in the diagnosis. There are other social factors also. It's important that this diagnosis must be done by a professional, by a psychiatrist, a psychologist, or even a medical doctor. So self-diagnosis, as much as this is meant for us to gain information and to help us understand the picture more, it's very important that if you are experiencing this, rather go to a professional and get proper diagnosis and assistance, because there are more questions that the professional will delve deeper into in order to understand the whole clinical picture before making the diagnosis. So let's stay, as much as this is to help us understand, let's stay away from trying to self-diagnose. So those being the symptoms of generalized anxiety disorder. Let's also then look at some of the treatment options that are available for this type of disorder. When we talked about the causes, we touched on a variety of things. So depending on what is the main cause of the disorder, there are a combination of treatment options that are also available. The main options really range between psychotherapy, pharmacological or medication, as well as the other psychotherapeutic related approaches, such as your relaxation and mindfulness approaches. When it comes to psychotherapy, there are different approaches there, but the most common one is cognitive behavior therapy, because there we deal, as you will realize, that when it comes to generalized anxiety disorder, it's more about the person's thoughts and their experiences and anticipation. So it's very important that we work with the cognitive processes that lead to the illness, in order to normalize that picture through cognitive behavior therapy. And also then, where necessary and when the diagnosis has been done properly by the relevant and qualified practitioner, medication can also be indicated as part of the treatment. But it's also important for one to note that some of the medication can be addictive. So it's not advisable to go on medication on a prolonged period and without a proper prescription by your qualified psychiatrist or medical practitioner. Very important that you keep in touch with your doctor or your psychiatrist as when you are on treatment, in order to make sure that you can minimize the impact or the negative impact of medication that might be associated with the type of medical treatment that you may be on. Another form of treatment as I said, includes just acceptance and relaxation approaches such as mindfulness, where you actually train yourself to relax in situations where you are confronted with those anxiety symptoms, exercises such as meditation, even yoga, and even including whatever spiritual exercises that you can embark on that can be helpful in managing the anxiety symptoms. So that goes for general anxiety disorder. I would like then also to touch on panic disorder, because it is also another common anxiety disorder that often features up in or shows up in our therapy rooms. In panic disorder, the individual experiences recurrent, unexpected panic attacks and is persistently concerned or worried about having more panic attacks, or changes their behavior in maladaptive ways because of the panic attacks. For example, a person might stop going to public spaces or shopping malls because they once experienced a panic attack there, and now they fear the panic attack coming back or recurring, and therefore their life centers around avoidance behaviors in order not to re-experience that. Panic attacks are abrupt surges of intense fear or intense discomfort that reach a peak within minutes, accompanied by physical and cognitive symptoms. Sorry, my heater just went off there. Let me just switch it off if you'll allow me to do that. Sorry about that, and welcome back. So yeah, we're still talking panic disorders. That panics may be expected, such as in response to a typical feared object or situation, or it might also happen unexpectedly, meaning that the panic attack just happens for no apparent reason. So what are some of the symptoms that you are likely to experience when experiencing a panic attack? The anxiety symptoms that we talked about earlier on are also applicable here, and these include palpitations, sweating, trembling hands or shaking, sweating, feelings of choking, chest pains, nausea, feeling dizzy, even numbness or tingling sensations, fear of losing control or going crazy, and sometimes even fear of dying. When the attack comes, it is so real for the person, but it's also important to know that with a panic attack, it is short-lived, right? But when you start experiencing recurrent panic attacks, then we are talking about the panic disorder. So that's the difference between a panic attack is the one event that happens in response to, sometimes it's not in response to anything, it is just for no apparent reason. Sometimes it is in response to something that is feared. And when that then happens frequently, we may then develop a panic disorder. So repeated unexpected panic attacks are we are now going through the diagnostic criteria for a panic disorder. You have to have recurrent unexpected panic attacks. At least one of the attacks must be followed by, within a month or more, one of both of the following symptoms: persistent concern or worry about having another attack. So if you're getting, because you once had a panic attack, now you start worrying that, oh, if I go into this meeting, or if I go into the public, or if I do this, there are more panic attacks that are coming. And also, there must be a significant maladaptive change in behavior that's related to the attack. For example, when a person then starts avoiding panic attacks by avoiding going to those places, as I already explained. So there must be the fear or worry of the attack happening again, and the behavior associated with avoidance of the event happening or the anticipated event from happening. Also, the disturbance must not be attributed to any physiological effect of a substance, for example, drug or medication, similar to the generalized anxiety disorder. And also, it must not be part of the picture of another mental health illness. Which is very similar to also the generalized anxiety disorder that we talked about. So that is panic disorder versus a panic attack. And similarly, in terms of treatment, it's a combination of treatment of psychotherapy as well as medication. With anxiety disorders, psychotherapy is always the first option or the preferred option. And when it is not manageable, then recommendation might then be made to go by a psychologist for the person to go and consult with a psychiatrist, and therefore be able to get medical assistance in managing the anxiety disorder. But because the root cause really in terms of management is more in the cognitive functioning. That's why cognitive behavior therapy is the number one therapy at the moment. There are different approaches, obviously, but that is the most common one. Similarly, relaxation and mindfulness exercises might also be of assistance, especially when you are going through that process of having a panic attack. And also very important to understand is that when you are having a panic attack, it's unhelpful to try and fight the feeling that you're experiencing. What might be helpful at that point is just to remember that a panic attack does not last more than 10 minutes. And for the person experiencing that, the fear is very real. But also at that point in time, what is important is to engage your cognitive skills and remind yourself again that the thing that you fear the most is not likely to happen. It is it is the likelihood of that happening is very small, and the feeling will pass after a few minutes. So allow yourself to experience and feel that which you are feeling, and take those relaxation and breathing exercises to calm yourself down, and just to allow the experience to pass, because it surely and certainly will pass without the anticipated disaster from coming to pass, because the likelihood of it really is very little. And yes, it is understood that from a perspective of somebody experiencing that, the fear of that thing that is feared is very real. If you fear that you're going to be embarrassed, it is a very real fear. However, when you understand that some of the fear is as a result of the panic attack, which may be an a construction of your mind and not necessarily a real situation, one may begin then to learn that this phase does pass and I will still be okay when it's gone. So this is the end of the video for today. I hope you have taken something that will help you moving forward. Please, there are free toll-free lines that you can call if you need help. That will be shown at the end of the video. Please do take advantage of that if you think that you need help. Also, there's an email address that you can forward emails to me if you need any questions or to be answered, or you have any comments that you'd like to make in terms of the future videos and what we might be helpful for you as we continue on this channel. For today, thank you for tuning in. Please do share, like, and comment. And yeah, if you have not subscribed, please do subscribe. Thank you. God bless you.